Well, Aunt Martha's was founded about 38 years ago right in the city of Park Forest here, very near here. And the services were centered around teens, primarily social service work. And that is where the name came from. The Aunt Martha's employees at that time asked the children, what would you like this to be called? And I'm told that they said, well, I feel very comfortable when I come here. It's like coming to my aunt's house. We like to think that Aunt Martha lives in all of us, that Aunt Martha is a spirit of service and commitment to communities. In general, Aunt Martha's is a not-for-profit organization covering social services and health care, youth rescue, and other services. And as we developed service programs around youth and teens, we discovered that you cannot help teens without helping their parents and families. What makes us unique is that we will provide multiple subspecialty services either under one roof, or we have the capability to refer within our own network for subspecialty services. We provide primary care services in the form of family medicine, pediatrics, internal medicine, OB/GYN, and we also have subspecialists such as child and adolescent psychiatrists, therapists, and dentists. So we have those services available, and I would speak specifically about our behavioral health services and our dental services because we do not financially triage, meaning we don't just see children because they have insurance. We see about 50-50 adults and children to make sure that adults needing psychiatry and therapy receive that service, adults needing dental care receive that service. We found that in the 10 surrounding communities from our location, Hazel Crest has the highest numbers. So it is very significant that we were able to put a health center in the Hazel Crest community. The services that are offered in the Hazel Crest Health Center are family medicine, pediatrics, obstetrics and gynecology, and dentistry. The Hazel Crest Community Health Center is a collaboration with the Advocate South Suburban Hospital. The concept being that emergency rooms all over the country, and particularly the South Suburban Hospital emergency room, is suffering from the same problem in that they have a huge non-emergent use of their services. This causes a bottleneck for severe emergencies that are coming through their doors that need their attention in a different way. Many emergency rooms are asking community health centers to put health centers within or near in proximity their emergency rooms so that non-emergent cases that are acute, but that can be seen in the doctor's office, can be seen quickly in a community health center. Our business model allows us to track patient flow, patient cycle time, patient wait time, and we monitor those things daily, weekly, and monthly, and we make real-time adjustments to schedules. So not only do we want to see patients efficiently, we need to see a certain volume of patients because we've made a commitment to the community to do so. We recognize that we don't want our patients to wait longer than they would in a private doctor's office. We presume that our patients are all VIPs and need to come in and see a certain aesthetic, to hear a certain kind of aesthetic, to see professionals, and to be in an environment that they know they're being well cared for. And one of those elements are how the waiting room looks, the colors, and the other is how long they have to wait to see the doctor. The doctors on Aunt Martha's are population bias, that's what I would say. They're people who understand community health. They understand that they'll be working at an aesthetically appealing mass unit is what I would call it, is that it's going to be busy, it's going to be a lot of need-based more than clinical needs. There are social needs of our patients that we have to address. So a doctor that works at Aunt Martha's would have to recognize both the clinical, the social, the emotional needs of their patients. But also it is part of our mission to serve patients whether or not they have the ability to pay. So no one gets turned away because they don't have the ability to pay. We have a sliding fee scale. It slides based on income, and it slides down to as low as $20. We're not going to turn patients away without the inability to pay, and many people find that once they come to know that, that fact and that there's a sliding fee scale, many people want to offer something in payment for their health care. But the point being, we're not turning people away without the ability. And mom can come and bring her children and have her personal care taken into account, get her children immunized, and she can drag her husband in too. I would say come to us as soon as possible. Reach us on our website at www.auntmarthas.org, or they can call us using our toll-free number, which is 1-877-MY-AUNT-M. Simply that. Or they can walk into the Hazel Crest Community Health Center.